Hi, so today I'm going to be talking about mental health, specifically mental health following birth and postpartum depression. After having a baby, most women expect to feel nothing but joy, happiness, extreme levels of love, but in about 20% of women, or approximately 600,000, they feel a lot of anxiousness, sadness, depression, panic, frustration, feelings of hopelessness, which is what we know now as postpartum depression and anxiety. Postpartum depression and anxiety affects about 20% of all new mothers, roughly 600,000. Each year are diagnosed with this disease, but it is expected that closer to 60% of women, almost 900,000, suffer from this every year. Postpartum depression is more than just the baby blues. It's a debilitating disease with tearfulness, intense feelings of inadequacy, guilt, fatigue. There's also physical symptoms such as headaches, rapid heart rate, muscle fatigue. Another one symptom is going to be a lack of feeling for a baby that a mother has, so a disconnect or a feeling of not that bond that mothers often have with newborn babies. These feelings can often occur in the first few months, but can go up to a year after the baby is born. Unfortunately, a lot of women just don't understand that these are normal, so they don't seek out help for these in the first year. There are a large range of symptoms that come along with these postpartums, depression and anxiety. It's not a one-size-fits-all. Some of these symptoms are extremely strong and some can be extremely weak. So while one mother may have an extreme feeling of anxiety, another can have an extreme feeling of just depression or just a lot of crying. So it's not a one-size-fits-all. Some other symptoms include crying often for no apparent reason, feeling extremely panicky, excessive worry about baby's health or just things that you can't change every day, the weather or things like that. One big thing is difficulty sleeping. New mothers are extremely tired because you're dealing with a newborn baby. But if you find that you can't sleep when the baby is sleeping, that's a big worry because one of the biggest things you can do for your health is to sleep. So if you're already tired and you're unable to sleep, that is a big concern. Or on the flip side of that, it can be that all you're doing is sleeping. So you're sleeping instead of caring for your child or feeding or bathing or things like that. So another issue would be problems concentrating, having frightening thoughts or fantasies. So a lot of women experience fantasies about their child dying or being kidnapped, things like that. Another very, very common feeling, which we have as parents, but in general, another big one is an extreme feeling of guilt. There's guilt about how you're going to handle motherhood, that your baby deserves better than you, or that you're not caring for even your spouse anymore, or that the baby's crying too much. So it just guilt over every little thing. There's some debate about what actually causes postpartum depression. Some researchers think that it's due to the rapid hormonal changes linked with pregnancy and childbirth. Those others feel that it comes from a genetic family history, or even just personal coping skills. So you never learned how to cope with such feelings. But one of the biggest contributing factors that everybody agrees with is that if you have a weak relationship with your partner or spouse, or no relationship with anybody that helps you to care for the baby, that leads to extreme cases of social isolation and a feeling of just loneliness, which definitely contributes to that feeling of depression. So definitely, if you know of a new mother who is trying to care for a child on their own, or you see that they don't have a very strong relationship with a partner, the best thing you can do is just try to help out as best as you can. There have been some preliminary studies by the American Journal of Psychiatry that says that there is an estrogen receptor gene in some women that does help to contribute to a postpartum depression. But there's also been another study done by Psychiatric Genetics that there's a postpartum psychosis in genes involved in the brain circuits with our neurotransmitter serotonin. So while some people feel it's just strictly a hormonal thing, others feel it is a genetic factor. Some other things that definitely can help trigger postpartum would be the death of a recent death of a loved one, economic stress. So if you're financially stressed, having a baby on top of that is definitely going to increase that feeling. Relationship problems, recent moves, or other big lifestyle changes at the same time as a baby can definitely affect that as well. Treatments. There's been a huge change in how we have been treating postpartum depression. Before, it was just to medicate right away, and it was medications were prescribed by OBs or family doctors. It's gotten away from that a lot now. Now it is therapy first, so trying to work on coping skills, whether that's setting realistic goals every day for yourself, or learning how to deal with new situations, or even having therapy with your family members. And then from there, if those coping skills don't help, your psychiatrist will often add in an antidepressant medication. Sometimes certain ones are safe to take when breastfeeding and some aren't, so that's up to the psychiatrist to decide if your severity is bad enough to need medication and to stop breastfeeding, or not, or if you're not breastfeeding at all, then that's a non-issue there, because there are all different types of levels and of severity with postpartum depression. That's why it's up to a psychiatrist to decide how to deal with it, because your OBs and your family doctors, while they are good help, they're not trained in how to deal with this, just to diagnose it. So the best thing that you can really do is, if as a new mom or a partner of a new mom who you see is feeling just some of these feelings, is to speak out. Even if it's to a partner, a friend, sibling, a new mom, but most importantly, it is important to talk to your doctor so that way they can get you the appropriate diagnosis and the best form of treatment, because only a doctor really can decide that for you. Some other health diagnosis or treatments are going to be to try to make healthy lifestyle choices. So getting physical exercise, walking, getting outside, trying to eat as best as you can, not just eating junk food, and trying to get healthier food options, and definitely avoid alcohol, because alcohol can cause some mood swings that can make your depression worse, and while it doesn't always feel like it is going to make it worse, in the long run it will. And then set realistic expectations for yourself. So don't try to pressure yourself into doing everything. Nobody expects your house to be completely clean or you to cook 2 fresh cooked meals every day. It's a goal such as brushing your teeth or making your bed or just changing out of your sweatpants, or not. If you don't physically feel comfortable enough to, then that's okay too. But just setting one realistic expectation for yourself, and that way small steps can increase to bigger steps. So today we made the bed, tomorrow maybe we'll vacuum and clean the bed. So just small expectations and goals like that. And one of the biggest things that you can do, which is actually probably one of the hardest, is to make time for yourself. So as you feel like the world is just coming down around you, try to do the best you can to just take that 10 minutes to shower or brush your teeth or just even leave the house without the baby. Take that time to just remember who you were beforehand and try the best that you can to do that, so that way your baby can get the best out of you as well. Just try to schedule some alone time, which is really hard in the first few weeks, but it's going to make a huge difference. And also try to avoid isolation. So as new parents, a lot of times we think we just want to avoid germs in the public because they're dirty and you don't really know what your baby's going to act like in public. But one of the best things that you can do is to get out and just be around people and to talk to somebody who is an adult, and that kind of thing. So definitely, if you're having these feelings of depression and things like that, it's best to just get out and be around people. And I can't speak enough as to how detrimental this disease can be. So if you need help, definitely get it.